Let's talk about the risks of procedures, especially the spinal procedures. People often ask, how dangerous is this procedure? I usually divide up the complications from a procedure into two types of complications. One is a common complication or a side effect coming from the medication that's injected, and then a more serious side effect or complication. The most common side effect, especially when we use a steroid in your procedure, is a side effect related to the steroid. That includes insomnia for a few days. It could be a water retention for a few days. Your blood sugar or glucose level will rise, especially if you're a diabetic, for the next week or two. For medial branch loss and radiofrequency ablations where we do not use steroid, we will not get this complication. Another complication or side effect you might get that's common is allergy to the medications we use. And that can range from allergy to the contrast we use, or it could be from the prep that we use to clean your back. Those two are the most common ones. Allergic reaction to local anesthetic and steroid are extremely rare because local anesthetic allergy is very rare phenomenon. Also, steroid is rare because steroid is used to treat some symptoms of allergy. However, you may have developed allergy to some of the preservatives that go into the steroid, and that can be seen once in a while. Let's talk about a more rare but serious side effect from pain procedures. We talked briefly in a separate video about anticoagulation or blood thinners. One of the side effects that you can have or complication you can have is bleeding in the spine called epidural hematoma. And why that is important is when the hematoma expands and presses on a nerve, you can have a neurological damage. Therefore, that is a rare but devastating side effect that can happen from a spinal procedure. Even if you are not on a blood thinner, you can still develop this in a rare occasion. Other rare but devastating side effects include nerve damage, paralysis because of a spinal cord injury, and if we're dealing with cervical or neck injections, stroke can happen with these injections. And so those are side effects that we do not want to see that are devastating but rare. Now, you may ask, how rare is this? I personally have not seen it in my practice. However, it does occur somewhere in the United States, and the rate is quoted anywhere between 0.01% or rarer than that, so even up to maybe 1.5%. So it is quite rare, and to put it into perspective, you probably have higher chance of getting into a car accident and hurting yourself than this happening from procedure.